Cameron Luxton.
Thank you, Mr. Chair. In your statutory oversight of Health New Zealand, what issues have you raised, or has the ministry raised any issues with Health New Zealand about the National Public Health Agency submitting on consents for restaurants in Wanaka, for example? Like
Happy Meals.
What has the ministry done to make sure that the public health service is actually concentrating on their obligations and not straying into other places where they probably shouldn't have their sticky beats?
Yeah, as you're probably aware, that the minister put out a press release on that issue a couple of days ago, I think a few days ago. That was an issue, a local issue within the National Public Health Service, and so there were certainly discussions between the minister and the head of that service.
Supplementary.
Yes, supplementary, Cam.
Thank you. So this is not a one-time occurrence. So previously in the year, they had the National Public Health Service has been submitting on food trucks in Invercargill. Did you take any steps at that point to bring them in line with what they are supposed to be doing?
Yeah, we've certainly had discussions with them about their role and function and the requirements for them to consider those when they are making.
So why do you think that that your advice and your guidance was being ignored?
Look, I can't really answer that question, except to say I think it's useful to remember that there are 90,000 people that work in Health New Zealand, and so it's inevitably challenging for Health New Zealand just because of the size and scope of the organisation. So
Agreed, but this is the very beast we're dealing with is a large beast that's gone from a whole lot of DHBs into one. We need to have confidence that they are actually focusing as best as they can. When you get repeated examples of straying into areas like submissions on a Wanaka McDonalds where they never even mentioned health outcomes, it was all about aesthetics. I have to wonder, and the committee has to wonder, are the proper guidance being given and adhered to, and why is the lessons not being learned?
just to be really clear, that's an operational issue within Health New Zealand. So it's properly managed by Health New Zealand. And so if you want to know more detail about how it's been operationally managed within Health New Zealand, I suggest you ask them tomorrow.
Thank you.